Hi, my name is Betsy Dovec, and I'm a bariatric surgeon at GBMC Hospital. But today, we're not talking about bariatric surgery. We are talking about another amazing surgical specialist, and it is colorectal surgery. We are talking today to Dr. Nina Ferraris. She joined GBMC in 2019, and she is an amazingly skilled surgeon. She has tons of countless stellar reviews, and if you watch this, you might just save a life, and it might be your own. We're gonna learn that kind of heavy, deep stuff today, but it's very important. So without further ado, welcome to Nina. Thank you so much for coming on and chatting with us today.
Thank you so much for having me. I'm very excited to be here.
Well, awesome. Well, first, before we dive into all the technical things, I want to get to know you better. We're both surgeons, we're colleagues, we're friends. I know you on a personal level. You're a super fun woman, but I want everybody else to get to know you out there as well. So tell me about yourself. Where did you grow up, and how is your young life?
So I'm originally from Connecticut, and I have moved around the East Coast quite a bit in all of my training. I like to think of myself as an East Coaster. I went to Texas for a short bit and came right back. Um, I haven't always known that I wanted to be a doctor, but I sort of figured it out along the way in training, in school, after working in research for a little while, and then came to medicine because it seemed like a good way to bring all of that information to the patients where it matters.
So was there, when you said, you've traveled around, you've been around, I saw that you went to NYU for undergrad. That must have been a
Yep.
blast. Oh my gosh, I'm so jealous of that. And then was there a moment where you decided, you know what, I love this. I'm going to go all in, I'm going for medicine.
Yeah, when I went into research, so my second year of research at NYU, I ended up working with some neurosurgeons actually. And they brought me into the OR for the first time, and that was kind of it for me.
Oh, I know. When you had that moment where you're like, oh my goodness, I want to be a surgeon. This is scary. It's a lot of training. What does it take to become a colorectal surgeon exactly?
What kind of training? So the 4 years of medical school that everybody goes through, and then 5 years of general surgery residency, and then an additional year of fellowship.
And I know that you did your fellowship here at GBMC. You're very, very well trained. You're super slick in the OR. I've seen you operate. You have like amazing skills. But I'm curious, what made you pick GBMC for your fellowship training?
So I actually chose it because of the program itself. It's more like an apprenticeship than a big tertiary care facility or something like that. And so I got to get very close to my mentors here and spend a lot of time with them. And I really had a lot of opportunity to be somewhat independent with a lot of oversight and good folks to talk to and learn from. So.
Yeah, our OR team here is second to none. I can speak to that. We have a lot of the same assistants and a lot of the same scrub techs and circulating nurses. GBMC's OR skill set is just next level. Next level. For a community hospital, this place is truly state of the art. So tell me, what exactly is a colon and rectal surgeon? What do you do?
So we do pretty much what the title says, any kind of a surgery involving the colon or rectum, and that can be both cancer cases or oncology cases, and also cases that we would call benign or other things like inflammatory bowel disease, diverticulitis. A large part of our practice is anorectal disease. So when you need someone to talk to about what's going on down there and you don't know who to talk to, that's me. And so that's a big part of our practice as well. And again, also obviously screening colonoscopy and preventative care as a big part of the practice also.
Okay, so how do you do these surgeries? What is the technique? Is it big open incisions, little tiny ones? How do you do it?
So everything is very individualized to the patient and their particular condition. I have trained quite a bit in minimally invasive surgery, and I prefer the minimally invasive approach whenever possible. I would like to think that we are able to do that for most of our cases, and I think that's true. The vast majority of our cases are minimally invasive, either laparoscopic or robotic. We are also trained on the Da Vinci robot and have been using it quite a bit, particularly for cases down in the pelvis or low down in the abdomen. The robot has been particularly helpful, and there are cases that I actually prefer that for as well.
Wow, so you do different things. You're doing anal stuff. You're also in the abdomen. How do I know if, I'm sure you get this all the time. You sort of said it at the beginning of this interview that, geez, you're a little bit embarrassed that, I'm having some pain when I have a bowel movement. I mean, this is a topic that I feel is so embarrassing. I just don't want to talk about it. How do you help patients with that in that difficult, sensitive time?
Well, I'd like to encourage them to come and see me. And I'd like to think that once they've made the appointment, it kind of gets easier from there because it is something that we talk about all the time. There is very little that's going to surprise me any longer. People really struggle with these issues. It can make a big difference in your quality of life, and getting things addressed so that you are more comfortable and can go about the rest of your life is important and can make a huge difference. I always say I get the best hugs from my hemorrhoid patients.
I love that. I'm sure. I mean, you're really, really helping them with something that is absolutely impacting the quality of your life. I mean, that would be awful, but you're so, I mean, I feel like I could just trust you. I would feel so comfortable with you. I know I have sent a lot of patients to you over the years, and I swear, in the last 2 years that you've been here, they always come back and they say, just thank you. Like, I felt super at ease with you. So that is an absolute talent. Now, if somebody does want to make an appointment with you, how do they do that?
So as of right now, we're having everybody call the office. So the office telephone number is there on the screen, 443-849-3130. If you call through the office, our secretaries are doing a wonderful job of juggling our schedules in this time of uncertainty, and with the COVID restrictions and everything, it has been easier to go through a person, but they've been doing a great job trying to get people in as quickly as we can so that we can get everybody seen.
Well, let's talk about some of those COVID restrictions in terms of office visits, getting started, getting to meet you for the first time. How are you doing these visits? Are you still seeing patients in the office, or are you not able to?
We are still seeing some patients in the office, particularly if when you call, you give information that makes it sound like you have a condition that really would be best addressed in the office, in person, potentially even involving a minor procedure to help you feel better faster. Any case that we think is at risk of ending up in the emergency department, we are trying to see in the office so that those patients don't have to go to the emergency department, just trying to streamline care and make it a little bit more comfortable for the patients. I am unfortunately meeting some of my patients for the first time on the video, but that's been going really well too. People are really seem to be enjoying it. The novelty is kind of funny, and all my patients have been great. Some of my folks, I am meeting on a video visit initially, and we kind of talk about what their issue is, and then if it's something that I really need to see in person, we can bring them into the office. Sometimes I'm able to actually put them on a list to schedule an elective procedure without even needing to see them in the office. I have also had a few patients send in pictures, which is entertaining in my specialty. They're all very confidential, but that has been super helpful as well. It's actually been surprising how well we've been able to do with the video visits. So.
I mean, I agree. Do you feel after this is all said and done, we go back to our normal lives, do you feel like you're going to continue doing the video visits?
Probably for some applications, there are certain things where it certainly is a little bit easier, and the patient really doesn't need to be in front of me in the office. Particularly things like colonoscopy screenings or some of our follow-ups. If the patient's doing well, they might certainly be able to request a video visit so that they don't have to come in, might make it a little bit more convenient for them. fit into their schedule a little bit easier. They don't have to leave work in the middle of the day. And then there are other things that are just better in person. So.
Perfect. Perfect. I know that it can seem intimidating, again, to get started with a colon and a rectal surgeon for a number of reasons. But today, Nina, we're really going to focus a lot on colon and rectal cancer. Now, I was reading a lot of reviews about you online, and one review just was especially touching. Somebody said that that you told them that they were diagnosed with colon cancer, and that this was an incredibly vulnerable time in their life. But you exuded empathy, grace, and you were incredibly gentle. I mean, how incredibly moving is that? I mean, that time in your life, it's scary. And I know that for the last couple of months, sometimes those screenings, colon and rectal cancer screenings, have gone by the wayside. So today, I want to celebrate March. March was Colon and Rectal Cancer Awareness Month, and I think it is imperative that we stress this today, the importance of those screenings. So if I'm out there, a random age, how do I know if I have colon or rectal cancer?
Yeah, I'm glad you brought that up because we did miss a little bit of the month of March with all of what has been going on, and screening really is important. Colonoscopies are truly one of the only ways that we have to actually screen for cancer and remove polyps before they turn into cancer. We can actually remove things that we know will become cancer eventually. It's actually really satisfying in terms of preventative care. Patients should look to have colon and rectal cancer screening performed if they are age 45 or older. Everybody has age 50 sort of in the back of their mind, but in 2018, the American College of Surgeons, the American Cancer Society, the ASCRS, multiple boards have all recommended bringing that age down to age 45. We are seeing younger patients with colon and rectal cancer, and the decrease in age is really aimed at picking those people up when they are early on in the process, low stage, or even just polyps that can be removed before they become cancer. There are also some symptoms of concern. I think a lot of people have seen a little bit of blood at some point after a bowel movement in their lives. And if that's something that's happening frequently or recurring, that is something that should be evaluated and not ignored. It is difficult to talk about. Sometimes it turns out to be just hemorrhoids, but it really is wise to rule out anything more important, like cancer or a polyp or something that might be causing the issue. Changes in bowel habits, sudden unexpected weight loss, less commonly abdominal pain or bloating, things like that. But, any real change, anything that's different and persists, really should be evaluated by a doctor. You can start with your primary care doctor, and then often they'll have you come see me.
Wow, I learned something, honestly. I did not know that the screening recommendations have changed to 45. Everyone out there, please hear that. 45 years old, you can prevent yourself from progressing from a polyp to cancer. That's huge news. That's huge information. So I know a lot of people think, oh, but I don't want to have a colonoscopy. Those hurt. Or what about that bowel prep? Can you expand on exactly what to expect to have this screening procedure done?
Absolutely. It's really not that bad. It is uncomfortable. You do have to do a bowel prep, and I don't think anybody's ever going to come to market with something that people think is delicious. But they have made significant strides in recent years. The bowel prep is significantly less cumbersome than it used to be. A lot of what you can do is actually clear liquid of your choice. Right now, the preps that we're favoring tend to be 2 small bottles, about the size of a Gatorade container. And so it's 2 bottles of the prep, and the rest of it can be the liquid of your choice. We recommend Gatorade or lemonade or any clear liquid, really, that makes you happy. And that makes it a little bit easier. Unfortunately, there's not much way around getting everything completely cleaned out, it involves some time in the bathroom. But everybody tells me that's the worst part. The day of the colonoscopy, in most cases, you show up to the hospital, we just built a new endoscopy center, which is beautiful. They've got private rooms, so you stay in the same room before and after your procedure. In a lot of cases, you're even able to have the same nurse during pre-op and during recovery. And most patients tell me they come in, they remember going back to the room, and then they remember waking up and being handed crackers and juice. There are worse days.
Yeah, it sounds lovely. It does. It does. It sounds pretty nice. And I have to tell you, I have seen that state-of-the-art Crow Center, and it's so beautiful. I'm so jealous of that too. I would love to get to do procedures there. It is truly state-of-the-art, all up to date, brand new. It is an amazing place to have your colonoscopy. So when can patients start getting these life-saving procedures again?
So GBMC has decided that at the end of May, so May 21st, will be the initial procedures, and we will have some special protocols in place. I'm sure there will be some kinks that need to be worked out. We, as a practice, myself and my partner, are also performing procedures at an outpatient facility in addition to the Crow's facility, and we are working very hard to get protocols in place to have this done safely for the patients. As of May 21st, we're going to start opening the center. I think my first date is the 26th. So we will start getting people in just as soon as we can.
So patients are now soon going to be able to start getting these screening colonoscopies. And as Dr. Ferraris said, some patients out there will be having some symptoms, maybe rectal bleeding, maybe weight loss, but some are asymptomatic, meaning you didn't know that you had anything going on inside of you. So as we said earlier, some patients are just stunned when they hear the news that they have cancer. When you tell a patient that, what are the next steps? I mean, what happens when you get that kind of a diagnosis?
Yeah, well, it's always a difficult thing to share with a patient, and it can be surprising, but we try to walk people through it as carefully as we can and as well as we can. Next steps after a diagnosis really do depend a little bit on the location of what we're looking at. Colon cancer is treated slightly differently than rectal cancer. So we'll bring you into the office. We'll talk about the location and the diagnosis. If it's colon cancer, next steps are usually surgical planning. For rectal cancer, depending on the size and the exact location of the lesion, we may have you see our colleagues in the oncology department for preoperative neoadjuvant chemotherapy and or radiation, because we know that improves outcomes for rectal cancer patients with surgical planning to follow. We do have a multidisciplinary GI tumor board also at GBMC, which meets several times a month, where all of our cases are presented to the group of oncologists, gastroenterologists, the colorectal surgeons, some general surgeons, and our oncology team, both medical and radiation oncology. We review all of the pathology and the radiology, and you basically get the benefit of this big multidisciplinary group in your surgical planning or plan of care.
Wow, I mean, that is amazing. I don't think a lot of people realize that when you get that diagnosis, you might feel lonely or scared, but you're not even close to alone. From hearing that there are these experts from around the world who have trained, who are now coming together to spend time speaking about one particular patient's case. How do we make sure, like you said, oncology is on board, radiation therapy is correct, the surgical options, pathology is there. I've always loved those tumor board meetings because I think they give a lot of hope. They give hope that the patient with this treatment care team behind them is going to be just fine. And it's not easy, I know that. Now, I know in your individual, speaking of teams, you at your practice, you have an awesome team. Can you tell me a little bit more about your partner, about your other team members that make that office hum so beautifully?
Sure, sure. So my partner is Dr. Joseph Duraco. He was actually one of my mentors here at GBMC, and I'm very pleased to have had the opportunity to come back and work with him. The two of us have become a colorectal division of GBM Health Partners. So we are very happy to be providing services both on campus here and at some of our outpatient surgical centers. I have two excellent medical secretaries, both of whom are named Kim. It makes planning very easy. I just tell them patients that Kim will call them, one of my Kims. And so they do a great job with all of our surgical scheduling, walking patients through the preoperative or pre-colonoscopy directions and screening and making sure that they feel comfortable with where they're going on the day of their procedure. Coming into the hospital, they do a great job. And we have a wonderful patient service advocate who also is answering our telephones in the office. Her name is Shar, and she's been doing a great job with us also. And you'll see medical assistants helping us in the office to help take care of patients. They really have done a great job coordinating both within our department and also across with other departments, with the oncology department and with the gastroenterology department when we need to.
Wow. You know, I have to say, you are, as we mentioned, you're personable, you're skilled, you're educated, you're well trained. You're just everything I would want in a doctor. If I had either a benign condition that was causing me distress, or if I, was diagnosed with cancer and I needed your intervention, I would feel so comfortable. So I want to ask this. Well, thank you. I want to know why. You had a lot of options. I'm sure you could have gone anywhere in the country. And I'm curious, what made you decide to make GBMC your home to be a colorectal surgeon?
I think for a lot of the same reasons that you chose it. You alluded to it earlier. We really have some excellent resources. Here at this hospital, we are a community hospital, which makes us a little bit more personable, I think, and a little bit more individualized in our delivery of care than some of the bigger centers. But we are offering the same state-of-the-art care at some of those bigger centers. We're offering the minimally invasive surgery. We've got a great crew in the operating room that helps us maintain really a very high level of sophistication in what we're able to do for our patients. We have great nursing staff. They provide really, again, personalized care for the patients. I have heard from so many patients how happy they are with their experience here at GBMC, and I think that part of that comes from being a community hospital and being a little bit more community oriented. And so to have those things together in one place just kind of seemed perfect.
Yeah, I couldn't agree more. I mean, GBMC has allowed all of us to offer state-of-the-art care with that personable touch. Our motto is treat every patient like it's your own loved one. And Dr. Ferraris, I mean, you're doing just that. And on behalf of everyone at GBMC, we thank you for your commitment to this field and for everything that you do. So I'm sure all of you out there are like, how do I get to know her? So the question is, how can our patients get started one more time with you and your specialty?
Yeah, please call the office. One of the girls would be happy to help you schedule an appointment. We are scheduling things a little bit spaced out at this point in time because of COVID restrictions. We are taking some extra precautions in the office if you have to come in. And even with our video visits, things are a little bit spaced. So please be patient with us. We will get you in just as soon as we can.
So everyone, you heard it. Please call the office. Do not delay your care. If that's one thing you've learned, yes, the last 2 months has been difficult, but Dr. Ferraris and everybody at GBMC Colon and Rectal Surgery is ready to take care of you. They're ready to see you. They are open, whether in person or a video visit. They will assess you. Please don't delay on those colonoscopy screenings. They could save your life. So thank you all for tuning in. Thank you so much for being on this little show today. I learned a lot. Get those colonoscopies starting at 45. It's one of the best tips I've learned. It could potentially even save my life very soon. So thank you for everything.
Absolutely. Thank you so much for having me. It's been a pleasure.